Good morning, everyone, and welcome to today's webinar on scaling qualitative research with AI. We first presented this talk back at the local government technology conference in London in June, and the response was really good. We had loads of questions, lots of people hoping to dig a bit deeper into how this actually works in practice. So that's why we've invited Emma back to come and share this as a webinar so that we can get into a bit more of the detail and share what we've learned so far. So for those of you that haven't met us before, I'm Lisa and I head up our marketing at Torchbox, and we are an employee-owned digital agency. And we work with forward-thinking public sector organisations to tackle complex challenges in progressive ways. And our work covers everything from research and safe-to-fail experiments and service design and digital delivery, always in really close collaboration with the partners that we're working with. So we work with organisations like the NHS and Office for National Statistics and local councils and cultural institutions like Tate and London Museum. But today, you're going to hear from our senior user researcher, Cassie, and our senior engineer, Madhav, and we're joined by Emma, who's a product manager at Guy's and St Thomas's NHS Foundation Trust. And together, we've been working on an experiment. So we've been using AI to conduct qualitative research interviews at scale, while still trying to capture those nuanced insights that you get from a person carrying out this kind of research. So we expect you're going to have lots of questions, so we'd love to hear them. So please put them in the Q&A if you can. It helps me to keep track of them a bit better. You'll find the Q&A at the bottom of the Zoom window, but love to hear feedback and comments in the chat as we go. We've got plenty of time at the end for the questions. I am recording the session today as well so that I can send it to you in a follow-up email along with the slides and any other resources that we reference as well. So I think that's about it, and I can hand over to Emma to tell you how this all began.
Thank you so much. It's lovely to see everyone today. So yeah, I'm Emma and I'm the product manager at Guy's and St Thomas's, and we are on a journey to build a new trust-wide intranet with Torchbox following a merger a few years ago now with the Royal Brompton and Harefield intranet. So we're creating one unified intranet for our staff. And our trusts, like so many others, are very geographically spread out. So we've got 5 hospital sites stretching from North London in Harefield down into Guy's and the St Thomas's sites in South London, but also 23 community sites that stretch into the depths of South East London. So we've got a massive geographical spread. And as part of the activity of building an intranet, we really need to find out what the current experiences are with our 2 intranets to really understand where our focus should be for building. And so that presented quite a big challenge. And I think it's a challenge that a lot of people here will really recognize. So how do you reach our 23,600 staff who work on separate IT systems? So we're still in that process of merging our IT systems and fully coming together. And so however we go out to reach people needs to be something that everyone, no matter what site they're on, can access. And that presents quite a big challenge for us. But also, and this is something you'll definitely recognize, so many of our staff groups and the ones that we don't often hear from the most are roaming, or they're working in the community. They might be roaming roles within our hospitals like porters, housekeepers, or there are nursing at home staff. And we very rarely hear from them in the kinds of standard user research that we do. But also, so many of our staff are working shifts in a 24/7 NHS. And so we often don't hear from our staff who are working night shifts or who are working twilight shifts, and their experiences of our intranets and getting information might be quite different, particularly out of hours, their routes to finding really important and critical information. And so not hearing from them has quite a big impact on the kind of intranet that we create together. And then finally, I know we'll all recognise this, if you work within the NHS or in the public sector in general, you are incredibly time poor, and that is, of course, extremely real for our clinical and operational colleagues. And they really struggle to commit to synchronous activity, to commit to an interview at 11 on Tuesday, because they don't know what their situation will actually be. And often it means that these staff groups instead will be booking time with us on their days off, and maybe they're less likely to show up if it's an in-person interview. And so given that there was this challenge, we thought that potentially we could look at using AI in the mix of solving it and getting out to some more staff groups. So why did we think about using AI? Well, actually, it can help us tackle a lot of these issues quite head on. So an AI moderated interview that someone can take up at any time that suits them best on any device, on any location, means that we thought we'd probably have a higher chance of accessing some of those wider variety of roles. So those clinical roles, those operational roles, and those roaming roles that typically we don't hear from. And then those working nights or non-standard hours would be free to actually engage with an AI moderated interview at any time that suited them best. So we hoped that maybe we would hear from some people who have different experiences of the intranet depending on the time of day that they're working. But also, and this was really important to us, is that we have a lot of neurodiverse staff or staff who in general are quite uncomfortable with human-led interviews, and that might be quite nervous and present quite a big barrier to entry. And as I think you'll see in some of the results coming up, we theorized, and maybe we're correct, in that actually non-human-led interviews for some groups of staff might be far more comfortable, and they're likely to still allow us to engage with them and get lots of stories from them in that way. And then an important one selfishly, which I want to talk about, is that it presented an opportunity to save on admin time for our project team. So as we're building this intranet, we're super busy. And as everyone knows, it takes a long time to go and coordinate interviews with people, set up that space, ensure that they've got the access to the Teams links and that it works in their calendar, and then to cope with the cancellations as well. And so we thought potentially it could be a great way of interviewing more people, but with far less administrative burden within our team. And then finally, AI moderated interviews, they represent an opportunity for going out to interview and getting research at scale, but with potentially less speed, less cost and more speed involved. So that was quite an exciting opportunity for us when we were thinking about using AI. But we did use humans and human moderated research first. And so we really want to present to you a bit of a dual approach here. And so we did go out in the traditional manner. So we had a human moderated phase in which we conducted consultations and interviews with 61 staff members. And 38 of those were your traditional in-depth one-on-one interviews where we're talking a lot about someone's individual experience and asking lots of follow-up questions. But 23 of those interviews were a little different. So we have a very famous fish and chips queue on a Friday at St. Thomas's. And in that queue, we thought we would use that queuing time productively to interview and talk to a good amount of staff. But also we were gate crashing existing meetings. So our resident doctor forums, for example, our nursing meetings, our roaming staff group meetings, to try and access them in places where they already were. And so both of those used a semi-structured script, and it really did deliver super deep contextual insights and a real range of narrative case studies. But I know you're all here because you're very interested in the AI moderated phase. And so I'll hand over to Madhav to talk a bit more about that.
Yeah, so the initial experiment was to see whether an AI interviewer, which we called Sonar internally, could do everything we required. The idea that an AI interviewer available 24/7 over a web interface would be accessible to a far larger audience, especially for people tight on time, like Emma mentioned. So in terms of pure numbers, we managed to gather insights from about 85 staff members. So how did we do this? We initially did some quick experiments with retail AI and validated that yes, we could make a reasonable AI interviewer. But compliance was our first major hurdle. Retail wasn't compliant with UK GDPR, and this was the case for a large number of AI companies based out of the US. And as you can imagine, that matters to an organization like the NHS. So we switched to LiveKit, an open source framework for managing voice calls capable of integrating voice AI agents. And we used OpenAI for the voice AI agent itself, from speech to text, so that it could understand what you're saying, convert it to text, then give it to the LLM, which handled the prompts and the logic, and finally text to speech, so it could talk back to you. Then we took the human interview script as our baseline and broke it down into multiple sections. As we did this, it was important to understand the goal of each section, so we could prompt the LLM in terms of persona to adopt and process, that is, questions to ask and in what order. Then we used tool calls to make sure the AI agent could go from one section to the next in the order that we wanted. And ta-da, interview bot. Before we put it out there, though, we had to make sure it could handle critical edge cases appropriately. So this meant if a user spoke about self-harm, they were automatically redirected to Samaritan's real-time chat helplines. And if a user was rude, they were ignored and nudged to stay on conversation. So to give you an idea of what we built, here's a quick demo from Cassie. Try to pay attention to, one, how the AI agent sort of probes and asks for further details, but also look for how it responds to emotion displayed by the user.
Great. Let's dive into what information you usually need in your work. What kinds of info do you find yourself looking up on a regular basis?
The most regular would be things like clinical guidelines, policies, and patient leaflets.
Got it. Clinical guidelines, policies, and patient leaflets sound really important for your work. When you need to find something like that, what's your usual go-to method?
So I'll go to one of the shared ward computers and open up the intranet. And normally I'll try and search. That doesn't always work. It sometimes takes a while, especially finding patient leaflets that are actually up to date. So yeah, it's the ward computers usually that I do that on.
Thanks for sharing that. It sounds like you rely a lot on those shared computers, but I can see how searching can be frustrating at times, especially with finding updated patient leaflets. Can you tell me about a time when you couldn't find what you were looking for? What did you do instead?
Yeah, just yesterday, there was a patient that was leaving hospital with her parent, and I needed to print out a patient leaflet, which I couldn't find on the internet. I'd been looking for a long time, and they were just waiting to leave. So I eventually just looked up a patient leaflet on a similar thing from another trust and used that instead.
That sounds really stressful, especially with the patient and parent waiting on you. It's great that you found a workaround, but I can imagine how that could cause some pressure. Is there anything else you'd like to share about your experiences finding information or anything related?
So what happened when this finally went out? I'll hand it over to Cassie.
Brilliant, thank you. You've all had a preview of my accent. It's from Canada, in case you were wondering, before you ask me if I'm American. So what worked well with this? Things did work well, which was great for us. So we did see broader reach across job roles. We saw more folks in communications and kind of back office roles, digital content, more porters, which was a group that we really struggled to get in-person contact with, chaplains, radiographers, procurement staff, and then less represented clinical voices too, especially the folks who go out into the community. And they were a really interesting user group for us because at the moment the internet is accessible just from a work computer. So we really wanted to hear from them, and we were able to. When I analyzed the data, it reinforced a lot of the human moderated interview findings at scale. So a lot of the core themes were strongly echoed, including issues with search, content, and mobile access. But it also surfaced new needs, which is really exciting. So we learned how people use social media as a workaround. We had functionality requests that we hadn't heard before. We got more insight from content editors, so the folks actually putting content on the internet. And as Emma hinted to, we heard from staff that had accessibility needs, who said that they felt more comfortable opening up to the AI. And that was particularly the case for neurodivergent users. The feedback we had was mostly positive, although I should caveat that the slider to rate was by default at a 3. But the majority of ratings were between 3 and 4 out of 5. And we got some really good qualitative feedback as well. I'll pass over to Madhav, who can start to tell you what we learned.
So on the flip side, we had a whole host of things that we were learning about and sort of addressing as we go. Our earliest lesson was that AIs get easily distracted without the appropriate guardrails. So in one of our earliest interviews, the conversation went completely off topic, but somehow the AI still managed to be helpful. To fix this, we added more guardrails in our quest to improve the interview experience. We made the prompts shorter and more focused on the goal. We added reminders to keep the AI on track if there were too many back and forths with the user within a section. And as it got better and had longer conversations, we started to see worse performance in terms of following directions and latency. So we had to reduce the context preserved between sections. But this introduced another issue. Because it didn't preserve full memory of what was said between sections, it would occasionally ask you a question you had already answered. This wasn't ideal, but we accepted this as a temporary compromise in favor of having more meaningful interviews overall. In terms of usage, we noticed that users were dropping off halfway through the calls, not seeing it through. We figured a more focused interview experience would help with this, and so we adjusted the script and the AI's persona accordingly. This meant a slightly less empathetic AI that was more focused on getting through the interview. But with this, we managed to reduce median interview duration from 16 minutes to 7, and that resulted in a significantly greater number of interview completions. But also, because the AI interviewer was an experiment that evolved into a prototype, we didn't have the convenience of an off-the-shelf product. This meant no admin screens, no dashboards. All changes were made directly in code, and analysis was a semi-manual process done outside of the tool. I'll hand it over to Cassie for the rest.
Thanks, Madhav. So we also found that the metadata, that we were collecting was inconsistent with the AI bot. So at the beginning, it would ask about your role and where it is that you work. And as Emma said, there are a lot of places that you could work, which made it quite difficult for us to be able to differentiate which intranet they were speaking about. So in order to fix this, we've come up with a solution of adding structured questions that are more quantitative in so like drop downs or text fields at the start of the interview. So we can have that metadata up front in a way that makes sense for us when we're analyzing. We also found that the transcripts that we got from the AI had less narrative and less emotion. So it captured pain points and feature requests really, really well. But when I was analyzing the data, I really struggled to find cause and effect stories coming out of them. And that kind of stuff comes out really strongly in human interviews because I can probe in a kind of stronger way. So although these were absent this time, we've learned lessons here about how we can prompt the AI to try and get more of those cause and effect stories when we use this in the future. So although some people really liked speaking to the AI, it also wasn't for everyone. Some found the bot to be patronizing in its paraphrasing or too dominant. We did adjust that, as Madhav said. Some neurodiverse folks prefer written formats, but we got positive feedback that the bot writing its words down was useful. Some people just didn't like feeling empathy from a bot. It felt really artificial. And some people really worried about doing this in a public or shared office space. It doesn't feel the same, I think, as having a call with a human. And so there was a bit of self-consciousness about doing it in a shared office. There were also language and articulation barriers. So several of the transcripts were harder for the AI to interpret because of the grammar or phrasing. And we get this in human moderated interviews too, but when I'm running those, I have the context of what was said in that interview in the back of my mind when I'm doing the analysis. The AI does not. So I worry here that the AI might favor native speakers and their transcripts because they are easier to quote and more kind of articulate. So we've talked about this. We don't want to introduce that bias. And so we want to start building out multi-language so people can interview in the language that they're most comfortable with. And then the output of that will be translated into the researcher's language for analysis. Interestingly, mobile uptake was not very high. When we built this, we thought anywhere, people can use it on any device, anywhere, they'll be in break rooms on their phones. But that wasn't the case here. And we suspect that's partly because of how we promoted the tool, which was on the intranet, which is desktop only currently, via work email channels, which tend to be checked on desktop devices. And also just anytime we work in kind of a B2B context, it tends to be more desktop focused than mobile. So regardless, we want to keep this open to any device. It works on any device. And I think we might see different percentages of people using mobile with different use cases. So recruitment was still a problem. So far, we've had 85 people take part, but it would have been nice to see more. So we struggled to recruit at the volume we'd hoped for. And as a potential fix, I think we need to look at baking in incentives moving forward, potentially integrating into research panels. That wouldn't work for this study, but for future ones, and just thinking more strategically about how we recruit folks to make sure that we're hearing from as many as possible. So should we start shifting to AI first? There are definitely savings to be had by doing AI interviews, as you can see here. 20 interviews human moderated is around 10 to 11K. If you did that with the AI moderator, it would be a couple £1,000s cheaper. But the real kind of differentiator here is when you're using AI interviews at scale. So if we were to do 200, you're looking at closer to 90K, whereas AI moderated, you're looking at around 9,000 for the same number of people. So the real savings come at scale, but as I mentioned, there is a cost of data depth and richness and kind of the ability to probe deeper into specific things if someone says something particularly interesting. At the bottom here, you can see that it's currently more expensive to set up an AI moderated interview, and that's because we haven't built an admin front end. So I had to send kind of everything I wanted in the tool to Madhav, who kind of baked that in for me with code. But should we move on to develop a front end, then that should even out the cost for setting up each study. So when does AI make sense? As I said, it's most cost effective at scale. So if you want a lot of breadth in your responses, I think this is going to be an appropriate tool here. And that's especially the case if the research is exploratory or involves hard to reach roles. I think you need to consider the breadth and depth trade-off. Anyone who works at an agency or is a user researcher knows that developing a research plan is all about these trade-offs. You're always kind of taking constraints, budget, time, that sort of thing into account when you're designing research. So that's something that needs to happen when you're considering using an AI interviewer. And ultimately, I think if you are using it, best practice is going to be to cast the net wide with AI, but still to conduct human interviews to ensure that you're getting the best of both worlds, as we did here. What's next for Guy's and St. Thomas's? Over to you, Emma.
Thank you. Yeah, we're really excited about the Sonar tool. And as Cassie said, we've seen 85 interviews so far over a relatively short time period, which is really exciting. And for us, the breadth that we are able to reach is really great. So we're hoping to keep Sonar open throughout our build phase as more and more people interact with us as we talk about their content migration, for example. They tell us that they want to give us some feedback or any opportunities to engage with the project in that way. And it's great to just be able to send them a link. And it's great that we can just keep featuring the link to give us feedback in our staff bulletins and in our news channels. And we hope that kind of the summer slump of engagement will end a little bit, and in the autumn we'll get a little bit more pickup. But as well, we're really excited about the further opportunities that Sonar provides for the project. So when we initially launch, we're launching in a bit of a beta fashion. We would love to be able to tweak the prompts and the interview kind of guardrails and script within Sonar to turn it into a bit of a pulse survey tool. So when someone has their first experience on the internet, we can capture what that was like for them and really get live feedback that we can use and directly iterate from. We think it's such an exciting way to be able to do that work and gives people a really proactive outlet to give their feedback, which we know when a new tool launches in our organizations is really important to staff, that they feel they have a voice about it and how they're finding it. And so Sonar represents a really cost-effective and exciting way for our staff to do that. But also, I think as we've been going through the process, we've been thinking a lot about all of the other things that Sonar could do, not just for us, but general use cases that we've been pondering that have been quite exciting and interesting. We know that so many of our staff will have experiences that they need to report. So you might use Datex or Radar, for example, to report an incident or an aggressive situation, report instances of racism, for example. And we were wondering about how AI could potentially humanize that process a little bit more, how empathy through an interviewer talking to you as opposed to just being presented with a form might feel. And there are lots of opportunities and use cases for trusts and wider public bodies to explore how AI supporting you to fill out something out and to ask those questions might actually mean that people access more support to them and all of the different types of support channels that are available following an incident, for example. So whilst it's not something we're actively exploring in this moment, it's like a string of ideas around what this kind of tool could do for our staff and the experience of working at Guy's St Thomas's. And we're excited at the moment to just be starting off with the internet and collecting feedback. But I think Sonar feels like a tool with a lot of possibilities. And so maybe Madhav can explore some more of those with you.
Yeah, so I think Emma and Cassie have done a great job of sort of hinting at the different things we're possibly looking at. And we have multiple ways to take it forward. So I'll just do a quick roundup. One is definitely finishing the admin section so that researchers can configure studies without a developer, and also automating analysis as a configurable workflow. So the goal is to have a more self-serve experience from a user researcher's perspective. Two, ensuring we don't miss metadata. With a semi-structured interview, sometimes critical metadata isn't captured, as Cassie mentioned. To fix this, we're looking at capturing it as part of the pre-interview process. Three, and this is a big one, multilingual support. So this would mean that the AI agent could conduct interviews in the user's native language, and the transcript and analysis could then be done in English, or perhaps even another language of the user researcher's choice. But besides this, we're actively looking for different applications of Sonar, from incident reporting, capturing ongoing feedback, and perhaps supporting human customer support agents as an on-call co-pilot. But if you have an interesting application for Sonar, we're definitely interested in hearing about it. So please reach out. But I'll hand it over to Lisa for Q&A.
Thank you very much, everybody. And we do have some brilliant, juicy questions for you all. So if you are ready, I will get going. So first of all, we have one from Natalie. Hello, Nat. She asked, did you need to tweak the questions and how much you could learn via this method compared to human interviews? And were there gaps you would have been able to ask more about if you'd been asking as a human that the AI bot wasn't able to draw out?
Yeah,
Cassie, is that best for you?
Yeah, there definitely were, especially because we altered the length of the interviews partway through, so we had to make it more concise. As a consequence of how we built the thing as well, it would go off the rails if we kind of kept the context window for the entire thing open. It gave someone some lovely career coaching accidentally. So we had to adjust it so it would kind of forget a little bit more and follow the prompts at each node. So as a consequence of that, some of the questions that it asked were quite repetitive anyway. It wasn't picking up an answer that someone had answered in a previous node. So even if it phrased a question in a different way, if someone was repeating, it wouldn't pick up that had already been said. So for that reason as well, we wanted to make it a little bit shorter. And as a consequence of doing that, obviously there's less depth in a human interview. I can recognize when something's been said and alter the questions, but an AI can't do that. So we definitely lost more of the kind of depth that you can go into and just the number of questions that we could ask, but there were reasons behind doing it that way.
We still need the human involved, don't we? So a question from Lauren. At the moment, users can only speak their responses. Is there a plan for them to be able to type as well?
Okay, I'm not sure this is for me, but that's a possibility. But I think the point of the tool is to be able to talk to it, but it's not something that we discard entirely. I think if it makes sense for people, we can definitely do it.
And I don't know if me coming in here around some of the rationale as well about why not would be useful. So we know that obviously GDPR and all of the kind of data protection around AI is very much a changing landscape. And for us, we didn't really want for there to be an input field where someone could copy and paste a ton of, sensitive information or something like that. So it was much easier to get quite a rapid project through our appropriate guardrails and channels and checks and balances internally when we didn't have that. So it felt like a more appropriate way for a project that we wanted to move at speed.
Brilliant, thanks, Emma. And Nicola asked, did you capture the actual audio from participants or transcripts only?
So we captured audio, but also transcripts. Initially, because this is, we're testing it out as an experiment. So the transcripts are what goes to analysis, so no one else will really see it. The only thing is sometimes the transcripts aren't perfect, and if we need to, say, examine why the AI bot switched to another language, for example, the audio was a great reference for that, but all data, once the study is done, is cleaned up.
Brilliant. Yes, our Chief Innovation Officer says that things keep translating into Welsh for him when he's speaking to things, which is interesting, and we're not sure why. Lauren Harrison asked, are costs based on time it takes multiplied by a salary?
Yeah, that's exactly how it's done. I just kind of estimated very vaguely how much things might cost if we were doing it as an agency, kind of from start to finish.
Brilliant, thank you. And Helena's asked, how many developer days were needed to build the bot? If you don't know off the top of your head, we can maybe go back to Helen.
I don't know off the top of my head, but I think maybe like 2 or 3 weeks.
Brilliant, thank you. And then we've got a couple more. Amy asked, how did you test the AI interview bot ahead of pushing it live?
Okay. Testing was a very involved process because obviously we wanted to get it right. So round one of testing was me sort of putting in the prompts, testing it locally, and making sure that it can hold a conversation. And once we broke it down to sections, I would also test sections individually and also sort of the extra parts like the edge cases, like if I want to end call, if I'm talking about self-harm, does it do exactly what it should? Then round two, once sort of it had passed my testing, was Cassie's testing to make sure that from a user researcher's perspective, it sort of behaves as it should. And after enough testing from the both of us, it finally went to Emma, and Emma and her team did a bunch of internal testing before sending it out to the rest of the guys in St. Thomas Trust.
Anything else on the testing, Cassie, at all?
And just to say, we also did a pilot with folks at the trust. So we had a handful of kind of trusted people who were willing to give feedback on it as well. So Emma sent it out to this group of people who were able to try it and then give us feedback on how their experience was.
Brilliant. We have a question from Ruth. Do you think that running AI first with selective human follow-up interviews might help provide more depth?
Absolutely. So we did it the opposite way. We did interviews first and then did the AI, but you could just as well do it that way and dig deeper. You could also have the same participants, potentially invite them to do an in-person interview or virtual interview. So yeah, you just need to design the research however it's going to work best for you.
Okay, brilliant. And we have a question from Dominic, probably for you, Emma. Are you looking to use Sonar as the AI chatbot to support users on the new intranet?
It's an interesting one that we're kind of live thinking about. Obviously that would kind of require some like integrational work there that we're not like totally sure about, but essentially we definitely know that we want it to be the first port of call for reporting kind of feedback and issues in a more conversational manner. So yeah, it's a live thing that we're considering, and we have a little bit before launch to make some decisions there, but it would be a really great and useful thing and help our users feel way more supported in their new experience.
Thank you. And we've got an interesting one from Nicola, because we were talking about this yesterday. Nicola, how did we decide on the interviewer voice? Because this might not be everybody's cup of tea. She said, I used to work as a producer for audio guys, and one learning from that is that voices and accents can elicit powerful reactions, positive, negative, feeling supported versus patronized, etc. So we did have that chat yesterday, didn't we, about prioritizing, being able to select different voice option. So it's not there yet, but it's definitely something we're exploring as well. So basically with the situation at the moment is that this is an experiment that we've been designing with guys, but Sonar can evolve. It might be that like Emma had some brilliant examples using it for pulse surveys and using it for incident management and reporting is really good, but there are lots of different features. Cassie mentioned about the admin as well, being able to do proper reporting and things like that as well. So it can go in so many ways. It's really flexible. Mark, thank you for your question as well about multi-language. I hope that Madhav answered that in his slides as well. But if you are keen to find out more about Sonar or how you can use it as well, or if you're interested in just finding out more how you can do an experiment like this, we usually start with a 2-hour opportunity workshop to see where AI might be able to improve your services in some way. So they can be quite low risk to begin with, but if you're interested, let me know. I think that's all of the questions. So I'd just like to say a massive thank you to Cassie, Emma and Madhav for your time again today. And thank you to everybody for joining us and for bringing such good questions. I will send a follow-up email with the recording. So if you've got any more questions, then please do send them over to me and we will get back to you. So thanks everybody. Enjoy your day.